Welcome to your Integrated Care System induction. You are currently new to practice as a GP or general practice nurse, and you are now part of a general practice team. General practices participate within a network or cluster of practices called Primary Care Network or PCN. These networks work collaboratively together within your local area alongside other organisations, for example, acute trusts, local councils and local clinical commissioning groups, to form an Integrated Care Partnership or ICP or a Multi-Specialty Community Partnership or MCP. Local ICPs will then work together across a larger geographical area to form the Integrated Care System or ICS. This first module will explain the context of general practices within this system, give you an overview of the roles and functions, and explain who's who within the system. Primary Care Networks or PCNs form a key building block for the NHS long-term plan. Bringing general practices together to work at scale has been a policy priority for some years. Since the NHS was created in 1948, the population has grown, and people are living longer. Many people are living with long-term conditions such as diabetes and heart disease, or suffer with mental health issues and may need access to their local health services more often. Integrated Care Partnerships, or ICPs, are alliances of NHS providers that work together within a locality to deliver care by agreeing to collaborate rather than compete. These providers include hospitals, community services, mental health services and GPs. Social care and independent third sector providers may also be involved. An Integrated Care System, or ICS, is made up of multiple ICPs and MCPs, bringing together systems within systems across a larger geographical area and usually covers a region serving a population of more than 1 million. According to the King's Fund 2020, integrated care systems are a key part of the NHS long-term plan and are intended to bring about major changes in how health and care services are planned, paid for and delivered. There are many organisations that support the commissioning and delivery of services within our NHS. Clinical commissioning groups are NHS organisations set up by the Health and Social Care Act 2012 to organise the delivery of NHS services in England. The announcement that GPs would be part of this commissioning role was made in the 2010 White Paper, Equity and Excellence, Liberating the NHS. This was part of the government's advertised desire to create a clinically driven commissioning system that was more sensitive to the needs of patients. CCGs are made up of a CCG board and CCG members. The members are all the GP practices in a local area. Health Education England, or HEE, is another organisation, one which supports the commissioning and delivery of education and training for the current and future workforce within healthcare. It has been operational since June 2012. Health Education England exists for one reason only: to support the delivery of excellent healthcare and health improvement to the patients and public of England, by ensuring that the workforce of today and tomorrow has the right numbers, skills, values and behaviours at the right time and in the right place. Primary care training hubs provide the infrastructure for multi-professional training and education in primary care to support recruitment, retention and return of all staff groups. Training hubs bring together primary care organisations and education providers to deliver a much broader education platform that includes supporting clinical placements, apprenticeships, preceptorship programmes and many others. Training hubs are embedded within ICPs and the ICS and work directly with staff, practices and PCNs. NHS England and NHS Improvement have now come together as a single organisation. Their aim is to better support the NHS and help improve care for patients. It oversees the budget, planning, delivery and day-to-day operation of the commissioning side of the NHS in England, as set out in the Health and Social Care Act 2012. It is responsible for overseeing the National Health Services Foundation or hospital trusts, as well as independent providers that provide NHS-funded care, It also commissions dentistry, eye health, pharmacy services, as well as general practice. Other organisations that form part of our integrated care system include local medical committees, or LMCs, who are a statutory body in the UK. LMCs are recognised by successive NHS Acts as the professional organisation representing GPs and GP practices as a whole to primary care organisations and systems. LMCs interact and work with the General Practitioners Committee, or GPC, the British Medical Association, BMA, and other local representative committees in a variety of ways. They deliver conferences and provide guidance, advice and support to practices and GPs directly. LMCs typically work and are embedded within ICPs and the ICS. The NHS North West Leadership Academy empowers people in the North West to secure better health, care and well-being outcomes through leadership. Within the system and across diverse communities, they work to develop compassionate leaders and the conditions for inclusive, future-focused leadership. They are a member-led NHS organisation operating since 2007. By operating a membership model, they move in pace with their members. They are open to new approaches and engage with uncertainty together. By tracking developments on the horizon, they help members gain a view ahead. And through these partnerships, they co-create informed, targeted leadership development support and interventions.